Gentlemen, I'm Dr. Shalene Jomas, and for over 2 decades as a urologist specializing in men's health, I've sat across from thousands of husbands over 60 who've confided something deeply personal to me. They tell me about the look in their wife's eyes, not disappointment but sadness, the quiet distance that's grown between them. The intimacy that used to define their marriage now feels like a painful reminder of what they've lost. One patient, Robert, a 67-year-old retired teacher, sat in that very chair you're imagining right now and told me, "Doc, I love my wife more than the day I married her 42 years ago. But when we try to be intimate, I last maybe 2-3 minutes if I'm lucky. I see her trying to hide her feelings and it's killing me inside. I feel like I'm failing her." Robert's story isn't unique. Studies show that over 65% of men between 60 and 80 experience significant changes in bedroom stamina and control. But here's what I told Robert, and what I'm telling you today with absolute certainty. It doesn't have to be this way. You can bring back the fire, the passion, the deep connection you once shared with your wife, naturally, safely, and starting tonight. I'm sharing this with you discreetly because what I'm about to reveal is something the pharmaceutical industry doesn't want you to know. It's a gentle daily exercise that takes just 5 minutes, requires no equipment, no pills, no embarrassing devices, and it works by reawakening something inside your body that's simply been neglected, not broken. Section 1. The truth about what's changed and why it matters. Let me be direct with you, as one man to another. As we cross into our 60s, 70s, and beyond, our bodies naturally change. I'm not talking about disease or dysfunction. I'm talking about normal, predictable changes that happen to every single man who's blessed with a long life. The first change involves a group of muscles you've probably never even thought about, your pelvic floor muscles. These are the hidden muscles that wrap around the base of your anatomy, and they control everything related to stamina, intensity, and control during intimacy. Think of them as the brakes and accelerator of your intimate experience. From age 40 onward, if these muscles aren't actively exercised, they weaken by approximately 15% every decade. By 60, many men have lost nearly half of the natural strength in this critical muscle group. What does that mean in practical terms? It means you reach the point of no return much faster than you used to. It means less control, shorter duration, and yes, less satisfying experiences for both you and your wife. The second change is vascular. The same way your doctor monitors your heart health, the blood flow to your intimate anatomy requires healthy, flexible blood vessels. As we age, these vessels can become less efficient. You might achieve readiness, but maintaining it becomes challenging. The intensity you once felt naturally now feels muted, distant. But here's what I need you to understand, and I mean this from the bottom of my heart. None of this means you're broken. None of this means your intimate life with your wife is over. I've helped men in their 70s and even 80s completely transform their bedroom confidence and stamina using the exact method I'm sharing with you today. I remember James, 71, who came to me after avoiding intimacy with his wife for nearly a year. He was ashamed, depressed, avoiding even simple affection because he knew where it might lead. 3 weeks after I taught him this technique, he sent me a handwritten note that I keep in my desk drawer. It simply said, "Doc, you gave me back my marriage. Susan and I feel like newlyweds again. Thank you for treating me like a man, not a patient." The emotional impact of these changes extends far beyond the bedroom. When intimacy falters, so does the entire foundation of marital closeness. The playful touching stops. The deep conversations become surface level. You start feeling more like roommates than lovers. And your wife, the woman who's stood by your side through everything, she starts wondering if you still desire her, if you still find her attractive, if the passion you once shared is gone forever. That emotional distance? That's what we're really fixing today. Because when you restore your stamina and control naturally, you're not just improving physical performance. You're rebuilding emotional intimacy, vulnerability, passion, and the profound connection that makes a marriage truly fulfilling in these golden years. Section 2. Why pills and quick fixes keep you trapped. Now, before I reveal the exact technique, I need to address something honestly. Many of you watching this have probably tried the conventional solutions. Maybe your doctor prescribed you one of those little blue pills. Maybe you've spent hundreds of dollars on supplements promising miraculous results. Maybe you've even considered more invasive options out of sheer desperation. Let me be crystal clear, I'm not here to demonize these options. Medications like Viagra or Cialis have their place in medicine. I've prescribed them myself when appropriate. But here's what the pharmaceutical company's marketing doesn't tell you, and what I'm obligated to share as your trusted physician. These medications are temporary band-aids, not solutions. They work by forcing blood flow to your anatomy through chemical manipulation. They can help you achieve readiness, yes. But stamina, control, lasting power? These pills do absolutely nothing to address those critical factors. You might get ready faster or more reliably, but you'll still face the same 2-minute, 3-minute challenge that's causing the real frustration in your marriage. Thomas, a 64-year-old patient, spent over $2,000 in 1 year on these medications. He told me, "Dr. Jomas, I can get ready now, but I still can't last more than a few minutes. My wife appreciates the effort, but I can see in her eyes that something's still missing. We start, and before we can really connect, it's over. I feel like I'm letting her down every single time." The second problem with these pharmaceutical solutions is the side effects. Headaches, facial flushing, visual disturbances, dangerously low blood pressure when combined with certain medications, and for some men, a psychological dependency that makes natural readiness even more difficult over time. And those supplements you see advertised everywhere, the ones with exotic-sounding herbs and promises of ancient secrets? Gentlemen, I've reviewed the clinical literature. The vast majority are either completely ineffective or contain trace amounts of the same pharmaceutical compounds as prescription medications, but unregulated and potentially dangerous. More importantly, none of these quick fixes teach your body how to naturally sustain stamina and control. They're crutches that keep you dependent, month after month, year after year, spending money while the root cause, those weakened pelvic muscles and compromised nerve pathways, continues to deteriorate. What I'm about to teach you is fundamentally different. This isn't a shortcut or a chemical override. This is about retraining your body to function the way it did naturally in your younger years, by strengthening the exact muscles and neural pathways responsible for stamina and control. It's about giving you sustainable, permanent improvement that doesn't require a pharmacy or a prescription, just 5 minutes of daily practice. Section 3, the breakthrough, what this gentle exercise actually is. So what is this gentle daily exercise that's helped thousands of my patients over 60 rediscover lasting bedroom stamina with their wives? It's called progressive pelvic floor control training. Or, as I explain it to my patients in simpler terms, it's the stamina exercise you never knew existed. Here's what makes this technique so powerful. You're going to systematically retrain the exact muscles that control your staying power during intimacy. These aren't the muscles you flex at the gym. These aren't your abdominals or your legs. These are the deep, internal pelvic floor muscles that every man has, but almost no man over 60 has consciously exercised in decades. When you perform this exercise correctly, and I'm going to walk you through every single detail, you're accomplishing 3 critical things simultaneously. First, you're rebuilding strength in the bulbocavernosus and ischiocavernosus muscles. These are the primary muscles responsible for control during intimacy. When they're strong, you have natural breaks. You can sense when you're approaching the point of no return, and you can actively slow down or pause without losing readiness or intensity. Second, you're increasing blood flow and vascular health to your entire pelvic region. This isn't forced chemical blood flow like medications provide. This is natural, sustained improvement in how efficiently blood fills and maintains your intimate anatomy. Third, and this is perhaps most important, you're reestablishing the mind-body connection between your conscious control and these muscles. Most men have completely lost awareness of these muscles. They've become automatic, firing reflexively without any conscious input. This exercise brings them back under your voluntary control. When I first taught this to Robert, the 67-year-old teacher I mentioned earlier, he was skeptical. He said, "Doc, I've been a man for 67 years. How can squeezing some muscles I can't even see change anything?" 3 weeks later, he returned for his follow-up appointment, grinning ear to ear. "Doc, last night my wife and I were intimate for over half an hour. Half an hour. I was able to slow down, speed up, completely control the experience. She told me it was like our honeymoon all over again. I actually had to stop and catch my breath. Not because I couldn't control myself, but because I wanted to make it last even longer for her." This exercise is gentle, private, and can be done anywhere, sitting at your desk, driving your car, watching television. Nobody will ever know you're doing it, but your wife will notice the difference in your bedroom. I absolutely promise you that. Section 4. The science. Why this works when everything else has failed. Now let me explain exactly why this exercise delivers such dramatic results, because understanding the science will help you perform it correctly and stay motivated during your first week of practice. Your pelvic floor is a hammock of muscles stretching from your pubic bone in front to your tailbone in back. Within this muscle group, 3 specific muscles are essential for bedroom stamina. The bulbocavernosus muscle wraps around the base of your shaft. When it contracts strongly, it pumps blood forcefully into your anatomy, creating firmness and intensity. When it's weak, blood flow becomes passive and inadequate. The ischiocavernosus muscles run along both sides, and they're responsible for maintaining pressure and preventing blood from draining out prematurely. Weak ischiocavernosus muscles mean you can achieve readiness but not sustain it reliably. The pubococcygeus muscle is the deepest layer, and it's the master controller of your ejaculatory reflex. This is your brake pedal during intimacy. When this muscle is strong and under your conscious control, you can literally stop the reflex from triggering, even when you're highly aroused. Think of it like this. Imagine trying to stop a runaway train with bicycle brakes. That's what weak pelvic muscles feel like during intimacy. You sense the point of no return approaching, you want to slow down, but you simply don't have the strength to override the reflex. Now imagine that same train with industrial-grade brakes that respond instantly to your command. That's what strong, well-trained pelvic muscles provide. When you exercise these muscles daily with the technique I'm teaching you, you trigger a cascade of physiological improvements. Increased nitric oxide production locally in the pelvic tissues. Nitric oxide is the same molecule that medications artificially boost, but you're stimulating your body to produce it naturally. This means healthier, more flexible blood vessels and more efficient blood flow without chemicals. Enhanced nerve sensitivity and neural pathway reinforcement. Every time you consciously contract and release these muscles, you're sending electrical signals through the pudendal nerve, the main nerve controlling sensation and function in your intimate anatomy. Over time, this strengthens the communication highway between your brain and your pelvic region, giving you more conscious control and heightened sensitivity. Hormonal optimization through regular, intimate activity. When you're able to sustain intimacy longer with your wife, your body releases higher levels of dopamine and oxytocin, the bonding hormones that make sex emotionally satisfying, not just physically relieving. This creates a positive feedback loop. Better stamina leads to better emotional connection, which increases desire and natural arousal, which makes subsequent intimate encounters even more satisfying. I had a patient, William, age 73, who was a retired engineer. He loved understanding how things worked. When I explained this science to him, something clicked. He told me, So you're telling me that I'm essentially rewiring my body's control system and rebuilding the hydraulic pump that's been losing pressure for years? Exactly right, I told him. And because he understood the mechanism, William practiced this exercise religiously, twice daily for 4 weeks. The results? He went from lasting barely 2 minutes to consistently enjoying 20, 30-minute intimate sessions with his wife. But more importantly, he told me the emotional transformation was even more profound than the physical one. The final piece of science I want you to understand involves something called proprioceptive awareness. This is your body's ability to sense and control muscles without visual feedback. Most men have zero proprioceptive awareness of their pelvic floor because these muscles operate automatically, reflexively. This exercise forces you to develop that awareness. At first, you might struggle to even feel the muscles contracting. That's completely normal. But within just 3 to 5 days of consistent practice, something remarkable happens. You'll suddenly be able to isolate these muscles precisely, contract them at varying strengths, and most importantly, you'll be able to engage them during intimacy with your wife to actively control your stamina and staying power. It's like learning to wiggle your ears. At first, it seems impossible, but once the neural pathway is established, it becomes second nature, automatic, and incredibly precise. Section 5. The exact technique. Step-by-step instructions. All right, gentlemen, here's the moment you've been waiting for. I'm going to walk you through the exact exercise step by step so you can begin practicing today and start seeing results as soon as tonight. Step 1. Identify the muscles. The first time you do this, I want you to be sitting comfortably in a private space. The easiest way to locate your pelvic floor muscles is to imagine you're urinating and you suddenly need to stop the flow midstream. The muscles you squeeze to stop urination, those are your pelvic floor muscles. Do not actually practice this during urination, as that can interfere with bladder health. But use that sensation as your reference point to identify the correct muscle group. You should feel a lifting, tightening sensation deep inside your pelvis, between your legs, pulling upward and inward. If you're contracting your buttocks, thighs, or abdomen, you're engaging the wrong muscles. The contraction should be internal and isolated. Step 2. The basic contraction sequence. Once you've identified the muscles, here's your daily practice routine. Contract those pelvic muscles firmly, as if you're pulling them up and in toward your belly button. Hold this contraction for exactly 5 seconds. You should feel tension but not pain. Start with moderate intensity, about 60% of your maximum squeeze strength. After 5 seconds, release completely and rest for 5 seconds. During this rest, consciously relax the muscles. Don't just stop contracting. Actively let them go loose. Repeat this contract, hold, release cycle 10 times. That's 1 set. Step 3. Progressive intensity training. After you've completed your first set of 10 repetitions, rest for 1 minute. Then perform a second set, but this time increase your contraction intensity to about 80% of maximum strength. The third and final set should be at maximum intensity. Squeeze as hard as you possibly can for those 5 seconds, then release completely. Common mistakes to avoid. Do not hold your breath during contractions. Breathe naturally and steadily throughout the exercise. Holding your breath creates tension in your abdomen and prevents you from isolating the pelvic muscles correctly. Do not rush the repetitions. 5 seconds contraction, 5 seconds rest. Use a timer or count slowly if necessary. Quality over speed is essential here. Do not skip days. Consistency is what builds strength. This exercise works because you're training muscles that have been neglected for years. Missing even 3 or 4 days can significantly slow your progress. Step 4. Daily practice schedule. I recommend practicing this exercise twice daily, once in the morning, once in the evening. Each session takes approximately 5 minutes total. That's just 10 minutes per day to transform your intimate life with your wife. You can do this while sitting at breakfast, during your commute, watching television in the evening, anywhere you have 5 minutes of privacy and can focus on the muscle contractions. Within the first 3 days, you should notice increased awareness of these muscles. By day 7, you should feel distinctly stronger contractions. And by week 2 or 3, you'll be able to engage these muscles during intimacy to actively control your stamina and staying power. Section 6. What to expect. Your timeline to renewed passion. Let me paint a picture of what the next 4 weeks can look like for you if you commit to this gentle daily exercise. Night 1 through 3. Even before you've built significant muscle strength, you'll likely notice subtle improvements. Many of my patients report heightened awareness during intimacy. You'll feel more present, more conscious of the sensations, and you might even experience brief moments where you can sense the point of no return approaching earlier than before. This awareness alone can give you an extra minute or two because you're no longer operating on pure reflex. You're starting to reconnect with your body. Week 1. By the end of your first week, you should notice measurably better control. Instead of lasting 2 or 3 minutes, you might consistently reach 5 to 7 minutes. Your wife will definitely notice the difference, even if she doesn't say anything immediately. One patient, David, 69 years old, told me his wife initiated intimacy twice in the first week after he started this exercise, something that hadn't happened in over a year. She later confided to him that she could feel his confidence returning, and that made her feel desired again. Week 2 through 3. This is when the transformation becomes undeniable. Your pelvic floor muscles are now significantly stronger, and your conscious control is much more refined. You'll be able to actively slow down or pause during intimacy, maintaining readiness while giving yourself time to reduce arousal levels. Most men at this stage report lasting 15 to 25 minutes consistently, but more importantly, the quality of intimacy changes. You're not just lasting longer, you're truly present, connected, able to focus on your wife's pleasure instead of desperately trying to delay your own reflex. Week 4 and beyond. By 1 month of consistent practice, this exercise will have become second nature. You'll perform it almost unconsciously throughout the day, and during intimacy, engaging those pelvic muscles to control stamina will feel as natural as breathing. Many of my patients report sustaining intimacy for 30-45 minutes or more at this stage. But the real transformation is emotional. Couples report feeling like they're dating again, increased frequency of intimate encounters, more physical affection throughout the day, deeper conversations, and a profound renewal of marital connection. Your wife's positive reaction is often the most rewarding part of this journey. She'll feel desired, appreciated, and valued in a way that's been missing from your marriage. That look of sadness I mentioned earlier, it transforms into something else entirely. Admiration, desire, deep contentment. Section 7. Bonus tips and critical warnings for lasting success. Now that you understand the core exercise, I want to share 3 additional tips that will accelerate your results and help you maintain them for years to come. Bonus. Tip 1. The strategic pause technique. During intimacy with your wife, when you feel yourself approaching 70-80% arousal, completely stop moving. Stay inside her, but pause all motion. Engage your pelvic floor muscles in a sustained contraction for 10 to 15 seconds while taking slow, deep breaths. This technique interrupts the arousal buildup, allows your nervous system to reset slightly, and gives you another 5 to 10 minutes of control. You can use this strategic pause 2 or 3 times during a single intimate encounter, effectively tripling or quadrupling your natural stamina. Bonus tip 2. Morning intimacy advantage. Your testosterone levels are highest in the morning, typically between 6 Watt and 9 am. If your schedule allows, consider intimate time with your wife during these morning hours. You'll have more natural energy, better firmness, and when combined with your strengthened pelvic muscles, significantly better control and stamina. Many couples fall into the trap of only attempting intimacy late at night when both partners are exhausted. Morning or early afternoon intimacy can be a game changer for men over 60. Bonus tip 3. Hydration and pelvic blood flow. This sounds simple, but it's remarkably effective. Drink 8 full glasses of water daily, with at least 2 of those glasses consumed in the 2 hours before intimate time with your wife. Proper hydration dramatically improves blood flow throughout your entire body, including your pelvic region. Better hydration means fuller, firmer readiness and improved sensation. Many of my patients report this simple change added 5 to 10 minutes to their stamina. Critical warnings. Do not perform this exercise if you have active urinary tract infections, prostate inflammation, or have recently had pelvic surgery. Consult your physician first in those cases. Do not overtrain these muscles, especially in the first 2 weeks. More is not better. Stick to the 2 5-minute sessions daily. Overtraining can lead to muscle fatigue and temporary loss of control. And finally, be patient with yourself. If you don't see dramatic results in the first 3 or 4 days, that's completely normal. Muscle strength and neural pathway development take time. Trust the process, stay consistent, and the results will come. Section 8. Your marriage deserves this second chapter. Gentlemen, as I sit here in my clinic sharing this with you, I'm thinking about all the couples whose lives have been transformed by this simple 5-minute daily exercise. I think about Robert and his wife of 42 years, rediscovering passion they thought was gone forever. I think about James, who avoided intimacy for a year out of shame, now initiating it with confidence and joy. I think about William, the engineer, who told me this exercise didn't just improve his bedroom life, it improved his entire marriage because his wife felt truly desired and cherished again. The intimacy you share with your wife in these golden years of your marriage isn't a luxury or an optional bonus. It's the foundation of your emotional connection, your vulnerability with each other, your continued partnership through everything life brings. What I've shared with you today, this progressive pelvic floor control training, this gentle, private 5-minute daily exercise, it's not magic. It's not a miracle. It's simply physiology, anatomy, and the remarkable ability of your body to rebuild strength and function when given the right stimulus. You don't need pills. You don't need expensive supplements. You don't need invasive procedures or embarrassing devices. You need 5 minutes twice a day, consistency, patience, and the understanding that your body is not broken. It's simply been neglected in this specific area. Starting tonight, you can begin rebuilding the stamina, control, and confidence that will transform your intimate life with your wife. Remember the technique. Identify those pelvic floor muscles. Contract for 5 seconds. Release for 5 seconds. 10 repetitions per set, 3 sets twice daily. Within a week, you'll feel the difference. Within 2 to 3 weeks, your wife will feel the difference. And within a month, you'll wonder why no doctor ever taught you this before. If this video has given you hope, if you're ready to surprise your wife and reconnect with her on the deepest level, I want to hear from you. Leave a comment below telling me I'm trying this for her so I know you're committed to this journey. Hit that like button so this information can reach other husbands who desperately need it. And subscribe to this channel because I'll be sharing more discreet, science-backed techniques to help men over 60 reclaim their confidence and vitality.